The next exercise is the hip three-way, in which you'll be doing hip abduction, hip flexion, and hip extension in 3 different exercises. The first way we're going to do this exercise is lying down, for those of you who don't feel comfortable standing. We're going to have her start with a straight leg raise. So Maggie, go ahead and straighten this leg down to the table. Again, the abdominals are very important whenever you do any of these exercises, so we're going to have her bring that belly button towards the spine, flatten the back before she does anything. She's always breathing. You're going to lift the leg straight up so it's even with the opposite leg, and then lower back down. Now this shouldn't cause any pain in the low back whatsoever, and go ahead and do it again, straight up and straight down. This is hip flexion. Now the second part of the exercise is on her side. So Maggie, I'm going to have you roll to your side. Very good. This one is hip abduction. So again, Maggie's abdominals are activated, her lumbar spine is stabilized with that belly button towards your spine. The top leg is going to go straight, and she's going to lift that leg straight up in the air and back down. Very good. The hip abductors, which are on that lateral side of the hip and a little bit in the back, are going to be activated during this. Back up and down. You could also put a weight on your ankle if you wanted to increase the resistance during this exercise. The third one during this is hip extension. If you're comfortable, you can do this one on your stomach. A lot of people, that does increase pain in their low back, so I'm going to show you how to do it in your side. So Maggie is going to keep her abdominals activated for that lumbar stabilization, and she's going to bring her leg straight back and forward. When she brings the leg back, she's going to squeeze that glute muscle. Good, straight forward. And you would do several repetitions of these, like it says in the article. So the next part of this exercise would be to, and if you didn't feel comfortable in lying down, we'd have you do it in standing, holding onto a countertop or something that's very stable, so that nothing tips over with the pressure of your weight. What I'm going to have you start with, Maggie, is hip flexion. So that's bringing that straight leg forward, making sure your belly button is towards your spine, your back is flat, and your lumbar spine is stabilized. So you're going to bring that leg forward and back. Again, working on the hip flexors, keeping the knee straight, not letting it bend. Good. The second part of this exercise is the hip abduction, bringing the leg out to the side. So same thing, lumbar spine is strong. Good. Out to the side. Keeping that foot parallel to the floor, not letting it turn out. Common mistake. So now Maggie is going to turn towards the table, and we're going to do the hip extension. And she's going to bring her straight leg backwards. Very good. Now notice she doesn't lean with the exercise. She keeps her trunk upright, and she's doing an excellent job.